Agents, this is Luis Moreno with Simply Health Insurance Agency. All right. Question today is we are outside of open enrollment. Can we still make a living selling ACA and help people enroll? I'm going to answer that question. Before I do that, guys, please make sure you give me the thumbs up. Make sure you comment and subscribe to my channel and share me, baby. All right. So can you still write ACA business outside of open enrollment? Hell yes, you sure can. There's a lot of opportunity to make money. The way to get into an ACA plan outside of the open enrollment window, which started November the 1st and ends January the 15th, outside that little window, you have to have a special election. Okay, bottom line. If you don't have a special election, then you're screwed. You can't do any, you can't write business. So you've got to find a potential special election that will work for you insured. I'm going to share this massive list that I got from healthcare.gov and we'll go over it. So here we go. All right. So special enrollment. All right. So number one is you may qualify for a special enrollment if you have a qualifying life event. So a qualifying life event can be having a baby, getting married, moving, losing credible coverage, losing insurance through your employer, Medicaid, CHIP, getting a divorce. That's another one. There's a lot of potential special election reasons that we can utilize. Okay, so also there is a low income SEP that you can utilize. I am going to share this chart here. 1 minute. All right. So low income, if the income falls between 100 and 150% of the federal poverty level. So what I have highlighted here in yellow, okay, if it falls between here and here, you qualify, or that insured will qualify for a low income SEP. Now, some states expanded Medicaid. For those states that did expand Medicaid, you've got to be, the window's a little smaller. You got to be between 138 and 150. Those other states that are here between the 100 and 138, they qualify for Medicaid. I'm in Texas. We don't have Medicaid, okay? Well, we do for certain demographics, but the average person, they're completely out of luck. But if they're between 100 and 150%, they get a low income SEP that lasts all year. All right. All right, let's continue here. Okay, so unexpected situations. You face a serious medical condition, natural disaster, or other national state level emergency that kept you from enrolling. Okay. All right, an unexpected hospitalization or a temporary cognitive disability or otherwise incapacitated. A natural disaster such as an earthquake, massive flooding, or hurricane. Something like that happened and you were eligible to enroll, but you didn't. Okay. Now, if that didn't happen when you were eligible to enroll, then this is not going to help you out. Okay. To qualify due to a natural disaster, you must live in that county that is eligible to apply for individual assistance or public assistance by FEMA. You have 60 days from the end of that FEMA designated incident period to complete your enrollment application. All right. Enrollment or plan display errors. So maybe misinformation, misrepresentation, misconduct, or inaction of someone working in an official capacity to help you enroll, like an insurance company, a navigator, a certified application counselor, or an agent/broker. And because of the information, the misrepresentation or misconduct, that kept you from enrolling in a plan or the right plan for you. And also kept you from getting the maximum premium tax credit or cost sharing reduction you qualified for. A technical error happened when you were applying on healthcare.gov. We haven't seen this happen very often, but in the past couple of years, it was, especially in the beginning, it was awful. And then we started having them when it was the last day of open enrollment. So many people were trying to get in, and it just caused some issues. All right. Becoming newly eligible for saving. Okay, so that's another one. You lost Medicaid or CHIP. So there's an unwinding that is happening across the country. Okay, every states have different schedules, but what they're doing is there was a public health emergency declared, and therefore anybody who was in Medicaid for the past 3 years did not have to re-enroll in Medicaid. They just stay on. Well, that ended, and now everybody has to requalify. So a couple of things are happening. People aren't requalifying. They're not submitting the paperwork, so they're losing Medicaid or CHIP. Or maybe their circumstances change where they now don't qualify. Either way, if you're losing Medicaid or CHIP, you can get into an ACA plan. Gaining or becoming a dependent due to a court order. So you gained a new dependent or became a dependent of someone else due to a child support or other court order. So that right there gives you another window to get in. Domestic abuse, violence, or spousal abandonment. You have an appeal, okay? You file an appeal with healthcare.gov because of an issue, and then that gives you a special election. So those are the eligible elections that you can utilize throughout the year to enroll in ACA. So the two most popular that I use, loss of coverage and the low income SEP. The other ones are there if you need them and if the insured qualifies for them. Hope that helps you out, guys. Again, don't forget, make sure you like this video, give me a comment, and then if you would, make sure if you're not subscribed, subscribe to my channel and share me. And click down below, guys. I'm going to have the link for that webpage. I'm also going to have some goodies there for you. I'm going to have the ACA 101 training. I'm going to have the agent CRM. This is the tool that I use to capture my consent to enroll and my confirmation of all the data that I entered, plus way many other workflows that I've created for you guys that you now will have access to. And I also have my an affiliate for the Facebook ad course that I recommend. Shauna, who created that course, changed my level of production because I was able to get way more leads, better qualified leads. They were booking their own appointments and for a lot less cost than when I was doing it because I had no idea what I was doing. So I hope that helps you out. And again, thank you guys.